it's been well recognized that obesity is associated with poor health outcomes and an increased risk of cardiovascular disease. Obesity is traditionally measured by the body mass index, which is a ratio of your weight to the square of your height. Body mass index has a few problems and limitations with it. Firstly, it doesn't take into consideration where this body weight is distributed. And we know that some people have a lot of weight distributed around their abdomen, others around their hips, for instance. And there's been an ongoing debate about the relative importance of where that body fat is distributed. Secondly, body mass index doesn't take muscle mass into consideration. And a great example is that a bodybuilder may have a similar body mass index to someone who is obese, but both of them have identical body mass indices. So we undertook this analysis of the PURE study, which involved about 150,000 middle-aged adults from countries of high, middle and low income, 21 countries in total. And what we sought to do was evaluate the relationship between different measures of body weight and body composition and what subsequently happened to these individuals after about 9 years of follow-up. So we found some really interesting discoveries. The first that jumps out is that actually being underweight, as reflected by a low body mass index of less than 20, is associated with a very high risk of death. And so we are concerned from this that factors like undernutrition may be a really important cause of death. On the other hand, high body mass index between the range of say 25 and 30 was not associated with an increased risk of death at all. In fact, it was completely neutral with regards to death, and high body mass index was only associated with a high risk of death at very extremely high body mass indices. Our second important finding was that the measurement of your waist circumference and hip circumference and putting the two together in the waist to hip ratio actually is a stronger predictor of developing cardiovascular disease than your body mass index. The third major finding that we came across was the importance of strength. We created a fairly new index where we took someone's muscle strength as measured by their hand grip, so how hard they could squeeze a device that measures strength in kilograms, and we divided that by their body weight to create a strength to weight ratio. And we found that the lower your strength relative to what your body weight is, the higher your risk of death.